single day. It's a real problem. We're seeing that 11.4 million people misuse prescriptions for opioids. In fact, out of every 100 prescriptions we write as physicians, 66 are for opioids. That's crazy. This is what I saw today when we were at the gas station getting gas in the Ann Arbor News. Fentanyl overdose deaths in the U.S. are doubling every year. You know, cannabis gets a bad rap because people buy cannabis off the street, and there's fentanyl in there, there's rat poison in there, there's cocaine in there. And I feel really bad because I work in the inner city, and when we do urine drug screens, when our patients come in labor and they're positive for cocaine, they're positive for marijuana, they're like, Dr. Rita, I really don't use cocaine. It's because this stuff is laced with other chemicals and drugs. So it's a really, really big problem. So CBD could be the solution for this opioid epidemic. We know that cannabis has been used for over 5,000 years as pain relief, as an analgesic. It's been used for all of those symptoms that cause pain and inflammation. In fact, cannabis has been shown to be safer than non-steroidal anti-inflammatory drugs. What happens if you take too many Motrin or Aleve? You'll either get GI bleed or you'll kill your kidneys. Right? We're seeing more dialysis centers open in Chicago on every other block, more than McDonald's and Walgreens, because people think that Aleve is benign. I can take Aleve, I can take Tylenol, it's safe. No, it isn't. In fact, there are studies in the 2009 Massachusetts study, and they did a study and they show that cannabis can effectively treat not only post-op pain, and I love using it in my patients that have had a tummy tuck or liposuction instead of using Norco. It is a very, very, very good option for pain. In fact, in 1988, Judge Francis Young did a ruling, and he was trying to show the DEA that cannabis is safe and effective, right? They went through extensive studies over 5,000 years, and guess what? They found not one person died from cannabis, ever. They did more extensive studies to find if they could kill an animal. They couldn't. The only thing they could conceivably find that is if you consume 1,500 pounds of cannabis in 15 minutes, you may die. But 9 times out of 10, what I tell my patients, when they get their medical marijuana card, that they'll just probably get sleepy and fall asleep if they take too much, right? Why doesn't anyone die from cannabis? Well, cannabis doesn't have any receptors in the medulla. The medulla part of the brain regulates respiration. The respiratory center of our brains have receptors for opioids. That's why people who take opioids die, and people who take cannabis don't die, because it does not affect our respiratory center. In fact, if you take 40 aspirin, guess what? You can get into some trouble. It can cause a lot of injury to your internal organs. Try eating 10 raw potatoes. That can get you into some trouble too. So it's impossible to eat enough cannabis, to smoke enough cannabis, to die. The worst that will happen to you is that you may get the munchies and you may fall asleep. So I tell my patients, just fall asleep. Or you can break the high with black pepper. You know, whatever you want to do. That's it. So we know the studies show that the opioids and the endocannabinoid receptors, they interact. In fact, we know that there's CBD receptor sites that can bind the opioid high. It can block the opioid addiction, the cravings, people who are on heroin or other opioids, giving them CBD instead of methadone. Why do we give methadone? Methadone is an opioid. Give CBD so we can block that addiction, block the addictive behaviors, block the depression of the dopamine. We can really make a lot of headway. Again, opioid and CBD interaction, what I do with my patients who are coming off of opioid and want to try the CBD, we use it together, and what they notice, they have a decreased need for opioids. It decreases the tolerance. It decreases the addictive symptoms. It decreases the addictive behaviors. And there's no respiratory depression because there's no receptors in the medulla that can get your patient into trouble. Adding cannabis to opioids, again, makes opioids safer. There's studies that are done. You'll find all these studies in the Annals of Internal Medicine. In fact, in JAMA, what they found are those states who have medical marijuana laws have a 8.5% reduction in opioid prescribing. So we're really helping these patients get off of Medicaid. And that was done by Medicare Part D. They did that study. So it's a really, really great tool for helping this opioid epidemic. Does anyone know who Robert Randall is? He's a pretty famous guy. He just passed away 4 years ago. But Robert Randall was told as a teenager in the early 70s, he had glaucoma. He was told by his ophthalmologist that he was going to go blind. Robert Randall tried every medication, every drop, everything that they do for glaucoma. Glaucoma is when you have an increased pressure in the eye. It puts pressure on the optic nerve. It's the #1 leading cause of blindness in adults. They told him he was going to go blind. He did everything. So what he did, he started growing his own marijuana because he said this is the only thing that helped. He got prosecuted. He turned around and sued the government. And he won. He was the very first American in 1976 to be legally approved to use cannabis for his glaucoma. And again, he never went blind. Cannabis was what helped his glaucoma. So again, cannabis, over 4 decades, they've seen that specifically the CBD part of the cannabis plant helps to decrease the intraocular pressure. It lowers the pressure by 25 to 30%. It is, again, a vasorelaxant. CBD causes the vessels to dilate and to relax, to decrease the blood pressure, decrease intraocular pressure, improve the blood flow. CBD is a neuroprotectant, so it helps protect that optic nerve. And so many people are getting great results from using CBD. And the great thing about CBD, you don't need a lot of it, especially in glaucoma. 40 milligrams or lower is all you need for that treatment. How about diabetes? A lot of studies have shown that CBD helps to decrease glucose levels, improve insulin resistance in diabetics. They saw that out of 579 users, 579 were current users, 1975 were past users, and what they saw, the current marijuana users had a 16% lower fasting insulin level. So many studies about cannabis and sex, improving those men who have erectile dysfunction. Why? CBD specifically is a vasorelaxant, improves blood flow to the penis, as well as women who suffer from vaginal atrophy, dry vaginas, libido issues, have such a significant improvement. A lot of studies, over 22,000 studies, you can find them very easily, how CBD improves blood pressure. Anxiety and depression, because those receptor sites, again, are found in the brain and the central nervous system, CBD actually improves the release of dopamine and serotonin, right? Improves anxiety, improves depression. Now, I love this slide. I don't know if anyone here knows anyone with tinnitus. It's ringing in the ear when you really don't have a sound, right? So I have a patient who I was giving CBD for her blood pressure, right? In my office, after you sit down and get weighed and everything, I talk to you extensively about CBD, and I talk to you about getting off of medications. And when you really explain CBD, and you really explain to your patients they're not going to get high, they're attentive. So this particular patient had high blood pressure, was on 3 medications, wanted to get off. I started her on CBD. On day 3, she tells me this story. She woke up screaming. And her husband's like, "Why are you screaming?" She's like, honey, I've not heard ringing in my ears for 3 days. So cannabis has side benefits. Even though I was giving her this CBD oil for her blood pressure, her tinnitus went away. Why? Vasorelaxant, neuroprotective, the nerves in the ears are not inflamed anymore. Her tinnitus went away. So there's a lot of studies that show that CBD can improve tinnitus as well. How do you take CBD oil? Well, one popular way is to use the CBD oil internally, putting it underneath your tongue and letting it stay to be absorbed for about a minute. And patients really love that. Some patients like to use it topically. They'll rub it on the area that hurts them. And some patients like to vape. Does anyone have a vape? They like to put it in their vape pen, and they like to vape. Because vaping's onset of action is very, very quick. You can get a response within about 30 seconds. So putting it under the tongue, letting it absorb in the bloodstream is a great way to do it. Now, I start my patients off, yes, I start my patients off slow. And we'll find that a lot of conditions don't need a lot. Of course, if you have several medical conditions, obviously you will need more. But I like to start with maybe 2 or 3 drops on the first day and double it on day 2. And then increase slowly until they get the response that they're looking for. So it really varies on how you respond and how you respond to CBD. It depends on a lot. Your medical condition, your body weight, the concentration of the product. So it's really good to start low and start slow. We even have CBD edibles, gummy bears, and chocolates, and all of these ways that you can infuse it in your food. Again, starting with a small amount and increasing until you get the results you're looking for. So one of the most common questions I get is, does CBD interact with my medications? Right? A lot of our patients are on 5, maybe 10, maybe 15 medications, right? And does CBD interact with my medications? That's a big question. Well, let's talk about the burden of disease. When we talk about drugs interacting without CBD, okay? Drug interactions is a big problem in the United States. It costs about $130 billion. It causes over 100,000 deaths. It's responsible for 2.2 million hospitalizations, and 79,000 children are affected from medications that we as physicians are giving our patients that are interacting adversely together. So it's a big, big problem. So again, when you're working with patients who have a lot of medical conditions, they may be on a lot of medications. Of course, the endocannabinoid system, you have to remember, totally has receptors on some of the 3, I would say, the 3 systems that we typically see most of our patients having issues: the neurologic system, the immunologic system, and the endocrine system, right? Most of our patients have diabetes, or they'll have an autoimmune disease, or they'll have some neurological issue, neuropathic pain, or conditions like epilepsy. So it's important to know how the drugs work in the endocannabinoid system, the pharmacokinetics, how the drug is metabolized, and if the interactions are good and bad. Well, CBD is metabolized in the liver. So it's important that you know that. And it's important that you understand which drugs they may be on that also are metabolized in the liver. Medications that are metabolized in the kidney and are peed out do not interact with CBD, but there are potential drugs that are metabolized in the liver that could interact with CBD. So the drugs that we're concerned about have the arrows. So those drugs are typically anti-seizure drugs. Those are really the drugs you have to be concerned about interacting with CBD. So the pathways that those drugs work in the cytochrome 450 pathway are 2C19 and 3A. So they did a study, and this study was to see at what dose did CBD interact negatively with these medications. And what they found in this study is that it's very, very, very rare that CBD even interacts with these medications. You would need high doses of CBD on a daily basis to theoretically interact with anti-seizure medications or any medications that are in the 2C19 or 3A4. High levels, we're talking about 2,000 milligrams a day. And remember, in most cases, most people only need about 20, at most 50 milligrams a day of CBD. They don't need those large levels. Well, let's look at the anti-seizure drugs. And on the bottom, you're going to see the anti-seizure drug. And then on the other axis, you're going to see what sort of changes when a person that are on these drugs takes CBD. And again, you only really see these two drugs that negatively react with CBD, meaning that CBD can decrease their efficacy. And if somebody has seizures and you give them CBD and it negatively affects, they could have more seizures, right? Or you'll see some drugs that fell out, very few, that it increased the potentiation, meaning that you give them CBD and they may become toxic. So again, overall, the studies and the research that I've done extensively shows that you would need very, very high levels to theoretically have a drug-drug interaction. So this slide shows how CBD works on different receptor pathways in the body that will cause those endogenous hormones, like the anandamide that we talked about, to be in homeostasis, to be in balance. And it does that through a pathway called fatty acid amide hydrolase. And CBD is important to be in the system so it blocks that enzyme. If you don't block that enzyme, then you can cause a lot of your endogenous cannabinoids to be deficient. Again, even CBD interactions on a nuclear level. Epigenetics is the DNA within our cellular makeup, and you can see how CBD works on different pathways, the PPAR, the GPR55. This is one, if you do studies on that, those are people who have osteoporosis, how CBD actually increases osteoblastic activity and helps those with osteoporosis. How do we enhance the effectiveness of CBD? Well, one thing is terpenes. And that's why when you're dealing with your patients, you want to make sure your patients don't go to the gas station and buy a CBD, right? Because it's not a very good product. You want to look for a full spectrum product that has not only all of the other cannabinoids that are important, like the CBD, CBC, CBG, but has terpenes. Terpenes actually enhance the effectiveness of CBD. Terpenes are what give the oil aroma. It gives also a lot of medicinal properties. Terpenes are anti-inflammatories, they're great antioxidants. So terpenes are found in foods like lemon, myrcene, limonene, a lot of the foods and herbs. Terpenes are important. The next one is polyunsaturated fatty acids, your omega-3s. And this is a really important point I want you to take down, is that you may have a patient that does not respond to CBD. And what we found is that if they're deficient in omega-3, if they're deficient in that fish oil, they may not respond. You need omega-3 around for CBD to work. So making sure that your product is a full spectrum product that has that polyunsaturated fatty acid omega-3. And then ketones. Ketones are something that our bodies will produce after a fast. Ketones may be produced because you're on a ketogenic diet, but ketones do mimic CBD. So you need ketones around. So terpenes, omega-3, and ketones enhance CBD. So it's important with your patients to really review the pathways of the medications that they're on to see if there's possibly any interaction that they can have. Some patients have perceived side effects, right? They still think that you're giving them that THC, so they'll come back to the office. I was high, Dr. Rita. I was like, no, you weren't. No, you weren't. Right. Placebo. Sometimes you do, many times, have to adjust their dosing of their medication sooner than later. When the endocannabinoid system puts the body back in balance, I've had patients come off of metformin, lisinopril, metoprolol. It's just been an amazing 2 years of me dealing with CBD in my practice. So it's a really, really thing you have to continue to dose adjustments, and then the slow approach. I can't emphasize that enough. Start low and start slow. Most patients need that slow approach. Others need that, we always talk about THC when a patient is getting that medical marijuana card. If they're new to marijuana, most patients who ask for a medical marijuana card are not new to marijuana, right? They've been smoking marijuana because it's the only thing that helps them. And they come to me and they're like, Doc, I want to do this legally. I have the diagnosis. I just want to be legal. And so those who are not new to cannabis can start out with a dose of 20 milligrams. But if you're new to this, start slow and start low. Again, for a recap, drug-drug interaction really is uncommon. I tell my medical students all the time, patients did not read the textbook. So you can have a patient coming in seizing with eclampsia that has a normal blood pressure, right? So you have to still be vigilant and make sure that if there's a possible drug interaction, that you really look at the pathways that those medications work. Cautious approach, making sure you start low and start slow. So, what is that song? I'm living my good life.